Welcome to the San Francisco HIV Frontline Organizing Group's AIDS 2020 poster. We are better known as SF HIV Fog. People living with HIV require a complex level of care, and frontline workers are the pivotal players in navigating and accessing the many resources that keep people living with HIV healthy and well. In turn, frontline workers require resources, education, and support to be successful. The mission of SF HIV Fog is to create platforms for frontline workers which promote connections, community, collaboration, and training, all ways to enhance the overall care for people living with HIV. People living with HIV in San Francisco depend heavily on the grant and community-funded services which constitute the public health system. This complex network is overwhelming and difficult to navigate. Many people rely on the knowledge and referral power of a community contact, such as a social worker, case manager, advocate, or payee, all known as frontline workers, in order to access the programs that sustain their vitality. Despite the key role that frontline workers play in the lives of people living with HIV, there are often massive gaps in their education and experience. In addition, frontline workers tend to maintain high caseloads and are prone to the effects of vicarious trauma. These conditions can lead to a work experience with little opportunity to seek professional advancement, and which often leads to burnout and high turnover rates.
Through funding provided by the San Francisco Department of Public Health, San Francisco HIV Fog has presented 22 training and networking events. Trainings are focused on current events and topics relevant to the HIV community, such as Hello Kinky, Open Enrollment Bootcamp, and HIV and AIDS. 87% of frontline workers who attended a training were able to implement the content learned within 30 days of attendance. SF HIV Fog has developed and grown a listserv with more than 400 frontline workers. The listserv acts as an interactive forum for frontline workers to share challenges, clarify assumptions, and learn new skills from various experts in the community. 88% of respondents reported that the listserv is a useful resource. Investing in frontline workers helps ensure that they strive to achieve their professional goals and to develop their skill sets. In 2017, SF HIV Fog initiated a scholarship fund for frontline workers to attend national conferences. SF HIV Fog is inspired by the collective vision that San Francisco is a city that operates from a seat of compassion. All individuals deserve an opportunity to learn about health and wellness. SF HIV Fog will continue to push forward in ending stigma and discrimination against people living with HIV by spreading the message of undetectable equals untransmittable.
Data collected indicates the success of the SF HIV Fog program objectives. Altogether, 95% of frontline workers would recommend a FOG training. This positive response has led to the development of a one-on-one community mentoring program. Creativity in programming, as well as consistent pivoting towards participant feedback, have been vital to SF HIV Fog's ongoing success. In response to COVID-19, SF HIV Fog has incorporated distance learning for training and offered guidance, support, and up-to-date info on the listserv. A collaborative between community-based organizations can serve as a model for agencies in other municipalities to support their frontline providers in the ability to give the best possible level of care for people living with HIV.